1822, April 2nd, on the road, driving to NYC.
ICU nurses Jamie Eatons and Ryan Ward on a whirlwind road trip from their home in Oklahoma to New York City after responding to an online posting for crisis travel nurses.
They're the Arches.
Yep.
Passing up St. Louis. We're, 6 hours into the drive?
I feel like it's our responsibility to step up and do what we've been trained to do and what we've known and felt like was our calling to do.
Jamie and Ryan, part of a growing wave, nurses by the hundreds, who will work 12-hour shifts for 21 straight days. They're helping hands desperately needed in New York City, where there are more dead from COVID-19 than from the 9/11 terror attacks.
I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now. We need relief.
Governor Cuomo temporarily suspending New York State license requirements, paving the way for licensed doctors and nurses from around the country to respond to that SOS.
I'm from Alabama. I'm currently in New York City helping with the COVID-19 crisis. And we're three of the nurses that flew in from Atlanta to New York to help fight the crisis.
Staffing agencies financially incentivize this work, paying so-called crisis rates that are typically much higher than regular rates, ranging from about $4,000 to as much as $10,000 per week.
That financial incentive, I think, is obviously a big part of what got us here initially, but over the course of this trip and getting here, we've seen in ourselves kind of a spiritual shift, if you will.
This isn't going to end in New York. This is going to be in our backyard at home. And I would hope that some nurses would take a step away from their families for a second and come help us if we needed it.
The couple learns they'll both be on the overnight shifts and working in intensive care units, but they'll be separated. Ryan assigned to a hospital in Manhattan, Jamie to one in Brooklyn.
Heading to our respective units and hospitals, ready to get to work. A lot of anticipation. Have an idea what we're going into, but should really know here shortly.
A few days into their work, reality starts to sink in.
It is bad. They are absolutely overloaded. Patients are incredibly sick. Everyone's vented. Everybody's COVID. It's all the things that you would absolutely expect. The nurses, they're overworked. They're having a hard time, and they've been doing this for weeks.
We can't build a nurse, we can't build a doctor out of thin air, so you have to get them here.
Critical care nurse Luke Adams drove from Pennsylvania to Staten Island last month, committing to a 13-week deployment.
Reality's starting to set in. It's like day 6.
To save money, he slept on this baby mattress in the back of his Renault SUV for more than a week.
It's not supposed to be as cold tonight, which is good.
After 2 days of onboarding at the hospital, Luke hit the ground running.
I'm helping them manage the 16 patients. It's a lot more than obviously I'm used to.
Back in the old world, what was the average load like?
You are usually a 2-to-1 ratio. So having 16 of those critically ill patients on ventilators and being responsible for all the medications that they're getting.
2-to-1 is one thing, but 16-to-1 sounds impossible.
I would have agreed with you until I started doing it. It's not just me. You know, there are other nurses that are there.
But through all the chaos and despair, Luke finds great solace in all the victories.
2 people that I took care of on my first day over 2 weeks ago. Now, they had already been there when I got there. And yesterday, as I was leaving the hospital, there they were, still in the same rooms, but now they're off the ventilator. The success stories are starting to happen. I cannot begin to describe how much that makes a difference, because for 2 straight weeks, it felt like we were losing.
I've showered and I'm getting ready for bed.
He's even in a hotel now after the city found him free housing.
It feels good. The bed felt amazing.
But even the comforts of a pillow and a nice mattress are no match for home. His baby daughter and 8-year-old son, hundreds of miles away.
I know that you want your example to be a teachable moment for your children. What do you want them to take from what you're doing right now?
Every emergency calls on a different service, and the skills that I've honed over the last 11 years were suddenly in need. If you have the ability, you have the responsibility, and that's what I want my kids to know.
What are you thinking right now? Where'd you go?
home, seeing them again. Especially my son.
Maybe he's watching. If he is, what might you say to him, Pop?
You know, this will pass and I will be home, so there's no need to worry. I know that this was difficult, but the 3 months that I'm gone would have paled in comparison to how I would have felt if I didn't come and help.
Beyond reinforcements from the outside like Luke, many hospitals are transitioning staff out of their specialty areas to fight COVID-19. Before coronavirus, Dr. William Levine spent his days operating on shoulders and elbows as one of the top orthopedic surgeons in New York City. Now he and one of his residents, Dr. Lynn Ann Forrester, are teamed up pulling 12-hour shifts in the emergency room, treating patients with COVID-19.
We have all these ICU beds that never existed, and all these patients that are filling those beds who are ventilated, they're sick, and they need care that our emergency room teams and our regular ICU teams cannot cover by themselves. They just can't do it.
It sounds like you went from being an orthopedic surgeon to a medical marine.
We basically, I was doing stuff that I haven't done in 25 years.
Dr. Levine is just one of 2,000 doctors in the New York Presbyterian Hospital system who've been redeployed to the front lines of the fight against COVID-19.
When was the last time you cried?
I've cried more in the last couple of weeks than I have in the last couple of years, probably, if I'm honest. I think the weight of this whole experience catches up with you.
How long can people stand up to do what you and your colleagues are having to do?
We still have 2,400 inpatients in the New York Presbyterian system, COVID positive. So we still got we got a lot of work to do and a lot of help to get us past this point.
We have had 2,000 doctors volunteer to be redeployed, and we haven't had to twist anybody's arm. I mean, the level of commitment has just been extraordinary.
Everyone rising to the occasion.
The outpouring of selflessness is really extraordinary. And it's a real spirit. It's the American spirit. It's the New York spirit. It's a can-do attitude.
It's been said adversity doesn't build character, it reveals it. Every night at 7, medical professionals have their shift changed. New Yorkers show their character. The city stops. Applause erupt. COVID-19 may have left many across New York and America helpless, but not hopeless.
I didn't expect that.
For Jamie and Ryan, New York City is not their home, but now forever, it is in their hearts.
Wow, that was amazing.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.